Okay, so I'm going to talk a bit about research from the FMD registry. Honestly, I don't need to do a lot of it because my colleagues have done an incredible job talking about most of the papers that have come out of the FMD registry so far. So I'll go through it briefly, and then we'll have my colleague Dr. Ramcharthur speak through it. Before I get started, I think I have a lot of gratitude and respect for my mentors, Dr. Gornick and Dr. Kim. When I came to Cleveland Clinic to do my vascular medicine fellowship, I didn't even know what FMD was. In fact, I remember I actually went back and did this after a few years. I realized the first patient that I ever wrote a paper on was this postpartum lady who actually had coronary dissections, postpartum coronary dissection, and at the same time had headaches, and so turned out had vertebral artery dissection. So we actually wrote a paper on it. And in my I didn't remember if I even put fibromuscular dysplasia in my differential. So actually, 5 years later, suddenly it struck me like that was the first paper. And so then I went and looked into my manuscript and I actually looked at the pictures to see, do I see beading in the scan? She didn't have any beading on the images that I had. But in my manuscript, I had written differential diagnosis included fibromuscular dysplasia, so it was there. But it's interesting how sometimes life, things sort of just how they start. But these two ladies taught me everything I know about fibromuscular dysplasia, coronary dissections, carotid dissections. I'm very grateful for their mentorship back then and even now. Um, and so with that, another thing that I do want to put forward is a lot of this is through patient organization, FMDSA. And Pam will talk about FMDSA a lot more, but all this started through the patient organization through which the registry has started. Is completely funded through the organization as well. So, and a lot of data that we are seeing today is actually through the registry. Everything we learn about it is through the registry. All right, so first question. Um, how many patients are currently there in the US FMD registry? 500, 3,000, 5,000, or a million? We need a few more answers. We can guess. There's no harm guessing. No one's optimistic. A million. No. All right. Okay. It's getting close. One. Okay. All right. So we'll move. Oops. Okay. How do I? What happened? Okay, so it's actually 5,000 now, almost 5,000. So last checked, it was 4,917 patients enrolled in the registry. So it's monumental where we are, and there's almost 14,000 follow-ups. So, that's another key aspect is not just identifying when you're diagnosed with FMD and what was going on, but really what was happening longitudinally, what happened 2 years later, 5 years later. Hopefully we'll learn, down the road what happens 20 years later. So that's sort of one important thing. All right, next question. Sorry, I think I'm. How many institutions are a part of the FMD registry? I think most of you have it correct. Currently, we have 21 institutions across the country that are part of the US FMD registry, and actually quite well spread out at this point. At one point, I think we were predominantly in the Northeast region. The FMDSA Society and the registry leaders have done a lot to make sure it's all across the country, and not only that, but also involve people sort of from other ethnicities and backgrounds. So there's, as you can see here, there's Texas Heart involved, among other institutions as well. And we have our group of folks here from this Southeast region at the conference today. So the registry has published 13 full manuscripts, as in full papers have been published so far, and there have been 21 abstracts that have been presented at several different conferences. This is probably one of the most important papers. It is an open access one also. Usually, if I ever want to look at it, I just type in international consensus document, fibromuscular dysplasia. I Google it, and this shows up quite easily. And this is a very thorough document that talks about every aspect about fibromuscular dysplasia management. And my colleagues have shared this information as we have gone through several talks. I think this paper was actually the first, most seminal paper that came out. I remember I was still doing my fellowship when this paper came out and really changed how we manage fibromuscular dysplasia today. And this was, they looked at a total of 447 patients at that point. Dr. Kim is part of this manuscript among several other, respected colleagues of ours in the field that were involved with this. And this is where we learned, as Dr. Morrison's already talked about this earlier, but we learned a lot of interesting things. We learned that FMD average age was in the 50s. Before this in medical school, what was taught is a typical person with FMD is 35-year-old, 25-year-old. This was clearly something that we learned. And then the other thing was they're predominantly women that was identified. The other key thing that came out of the registry is the fact is the delay in the diagnosis. Age of the symptom often was from the diagnosis was lagging almost 5 years. And I don't think this has changed a whole lot, anecdotally, at least when I see still this happening. So it's still, the same thing. The data this was on the first 447 patients. So after that, there was more updated data that came out when we had almost close to, I think, 1,000 patients. Really, none of that changed. The age was still in the 50s as the average age, majority were women. And then predominantly, we've seen this in white population. Saying that, I would say that it's not, I think we do see them in all ethnicities and all races. In fact, I remember when I was a fellow at Cleveland Clinic, Dr. Gornick brought these MRI scans that were actually, back then, you would just put them on the light and look at them. And she's like, these scans are from Mumbai, which is where I am from. And she was saying, these are so good quality. And we were looking at it. And this hospital where this patient was diagnosed with FMD, who flew to see Gornick, lived literally like 3-minute walk from where I live. So it is, I think it is present. And I think we have to make a lot more effort to now identify patients from all ethnicities, all races, and try to learn if FMD is different based on, your background and things along those lines. I think there's a lot to learn there. We've already heard about this as well. The paper did show that family history is quite relevant. Almost 1 out of 5 patients in the registry, they had family members who had aneurysm, sudden death was reported, and fibromuscular dysplasia was reported in 7.3% of family members. Now, saying that, I think we should understand that nobody was screening every family member. As you know, imaging is the diagnosis. So without really looking for it, 7.3% of patients reported family members with fibromuscular dysplasia. So it could potentially be a lot higher than that. Symptoms-wise, Dr. Kim touched on this. Symptoms-wise, the data that was shown, and we break it down into specific and non-specific. But when as physicians we use the term specific, what we are talking about is vascular ischemic symptoms. Did the decreased blood flow lead to a clear symptom? And so this paper did show that these patients had a high rate of stroke, TIAs, which is a mini stroke, subarachnoid hemorrhage, brain bleeds that were noted. But the other symptoms that are often hard to understand why a blood vessel abnormality would cause it, such as headaches, or hypertension at times, which is often essential hypertension rather than renovascular hypertension, were also quite common in patients. And as we learned more, pulsatile tinnitus, the swishing sound, was also reported quite high. But another striking factor was that almost 5% of patients had no symptoms at all. They had incidental finding. It was, for some reason they got a CT scan. I have patients who, get into a car accident, have a CT scan, and now they come to know they have FMD, but have no symptoms from it. So the presentation is quite variable from that perspective. The other thing this registry has taught us is this condition is polyvascular, in the sense is that there's very high odds that you will find FMD in more than one vascular bed. And typically the registry sort of broke this down, and what found out is most often it's going to be in 2 different sites, but it can even be up to 4 sites. And that sort of reminds me of one of my patients from University of Virginia. that I'll talk about a little later. But from the registry, when it published about 1,600 patients or so, they looked at the data, and what found out is almost 77% of patients had renal artery fibromuscular dysplasia, but also 66% of the patients had carotid artery fibromuscular dysplasia at the same time. And then as we look at other vessels, external iliac arteries, so your lower extremity vessels, 45% of them had fibromuscular dysplasia. 15% in the visceral arteries. These are your arteries that supply the stomach, liver, spleen. The vertebral arteries was about 16% reported, and then even upper extremity was reported in 23% of the patients. So this is one of my patients that I saw at UVA. She initially presented with a blue finger. And so gets a CT scan, and you can actually see some beaded appearance right there. She gets, this is a more closer appearance. You can see the irregularity in her brachial artery. The angiogram over here shows the beaded appearance. And as we looked further in her, she had FMD in her carotid arteries, her vertebral arteries, her renal arteries, her external iliac arteries as well. I think I remember she had in 7 different vascular beds. So it is possible. It can be present in more than one, very often more than one vascular bed. Now, the next paper that was published by the registry was actually published as a first author by Dr. Kim, which looked at, based on patient sex, is there a difference? We know that in men, this is not that common. So in the registry at that time, only 6% were men. But is there a difference when they're present? And they did see differences. In men, there was more abdominal pain, flank pain. Renal FMD was more common in men. And then the other thing that really stood out is the vascular complication rate was significantly higher in men, almost double. 20% average seen of dissections in women at that time, it was 40% in men. Aneurysm rates were also double. So it was certainly interesting and very concerning, but there is a clear variation in that presentation as well. The next paper that came out was looking at medication, specifically antiplatelets and antihypertensive medicines. And the thing that stood out, they looked at that time was about 800 plus patients. And interestingly, about 72% of patients were on an antihypertensive or an antiplatelet agent. Predominantly patients, when it came to antiplatelet, were actually on aspirin. The next paper that came out, this was one of the more major seminal paper, was trying to understand rates of dissections and aneurysms. And we've heard about this several times now during our conference. And this paper, really defined well beyond the fact that FMD can be present in more than one location, but it's also a systemic disease. More than 40% of patients in the registry had an aneurysm or a dissection or both. So it's very common, that we would find this in the registry. And then when we started looking into the breakdown, what we found out was, especially with dissections, carotid arteries were the most common one that was involved, followed by vertebral arteries and so on. With aneurysms, it was renal, and very close to it was actually the carotid arteries as well. And then the other interesting thing that stood out is when you looked at specifically FMD patients with aneurysms, what you saw was that more than half of them had some kind of procedure, and half of those procedures were for the aneurysm. And with dissections, about 1/3 of them had some kind of procedure, and about half of those were for the dissection. So, again, and we should also take this into consideration. This is data from specific registries. So you may be seeing a certain biases in what patients we see and what we learn from, but still very, very high numbers in general. The next paper was, looking at intracranial aneurysm presence in women with fibromuscular dysplasia. And as expected, we saw that 13% of women had intracranial aneurysms. But what was also more shocking to learn was more than 50% of them had more than one intracranial aneurysm when present. And a large number of them had high risk, which means as if it was greater than 5 millimeters in size. Those are the ones we start watching very closely. We are likely to fix them. 43% of women in the study had high, more than 5 mm in size, and about 19% was in the posterior circulation, so in the back circulation, where you're more likely to fix sooner rather than later. So again, high risk features. And the only thing that stood out as a risk factor was smoking. in this case. So obviously, stopping smoking is very important in this situation for fibromuscular dysplasia. Then a paper was published looking at children or pediatric population and compared to adults. And the number of patients we had was much smaller in the registry, but 33 patients who were pediatric age compared to almost 1,000 adults. But there were some key findings that stood out. One of the key things was a lot more males in the pediatric population with FMD, much stronger family history of hypertension. Their presentation was more likely to be renal artery FMD, more likely to have hypertension also, and less likely to have dissections, what we see often more in patients, adult patients with FMD. Here's another one that came out that was looking at patients older. And we wanted to understand what if you are a certain age and you're older. And so we took the cutoff as 65 years because that's Medicare cutoff. What we found out is in the registry at that time when we studied it, 1/6 of the patients actually fell in that category. And it was very interesting actually to learn because we always think if you're getting older, things are just going to get worse, right? But it was very sort of interesting what we learned here. We learned that a lot more patients that were older were asymptomatic. They were lesser likely to have headaches. They were lesser likely to have pulsatile tinnitus. They were lesser likely to have major vascular events or less likely to have procedures done. So there was sort of an interesting thing that we learned out of this is that at least we learned is that just because you're getting older doesn't mean your risk of having something bad is getting more. Then our colleague, Dr. Wells, who was earlier here with us, actually published this paper to learn more association between headaches and fibromuscular dysplasia. And Dr. Tarasaria actually touched on all this while he was talking about headaches and FMD management. But again, same thing. I think 2/3 of the patients have headaches in the FMD registry. Almost half of them will have headaches on a daily or at least weekly basis. A large percentage, more than half of these are migraine headaches. Again, more likely to we see this in younger patients who have also pulsatile tinnitus. Often they'll also have dizziness and more likely to have carotid, vertebral or intracranial aneurysms or dissections, and also often associated with depression. Then Dr. Dix, who was just here, talked to us about some of the topics, actually published this manuscript on pulsatile tinnitus through the registry. And again, very interesting, more than 1/3, 37% of patients had reported pulsatile tinnitus of some form. These patients were more likely to have extracranial carotid artery involvement. So carotid arteries were more likely, as you would expect, were seen to be present in these patients, more likely to have headaches, more likely to have dizziness, and as you would expect, if you put a stethoscope there, you're more likely to hear a carotid bruit. All right, so these are sort of the main papers that have come out. Of course, there were another 25 publications or poster presentations that have come out of the registry, but a lot we have learned today is, thankful to the registry. So thank you.